Tell us a little bit about what has changed, say, over the last 5 years in cosmetic dentistry.
Dentistry is always changing. There's always something new coming out. Most of it's really good stuff. The biggest change that I've noticed in the last 5 years is the materials. Years ago, the only option a patient had to have their teeth made over were either metal-based material with porcelain put on top of it, or all porcelain that would fracture pretty easily. The new materials, not only is there no metal in them, they're very resistant to fracturing and breaking and causing a patient inconvenience, possible pain. The new materials are very durable. They look so much more natural than even 5 years ago. In fact, since the materials change so frequently, a lot of offices even use the same shade guide from 20 years ago. And a shade guide's a little tabs of teeth. Yeah, that a patient will say, well, I like that color. Well, those don't actually even correspond to the material.
So basically the shade guide is just certain colors on this little guide that would...
And you may have seen them in an office if you've ever had Zoom. They hold it up to your mouth and say, this is the color you are and this is what we're moving to. With the new dental materials, that shade guide, especially with the bleach colors, doesn't even correspond to anything. And so what we have done, and this is one of the reasons it's nice to have a lab on site, we work very closely on being progressive and proactive on how our patient care goes about. One of the biggest concerns for patients is the color. Well, if you're using the shade guide and the materials don't actually match, you're not going to get the color you wanted. We actually went in and created our own shade guide with the actual materials, so a patient can pick, I like this color, and that's actually the color you're going to get. It's not a guess, well, we like between these two, and try and see how good you can get.
All right, so if someone's just, say, getting a couple of veneers, how closely can you match the color to their other teeth?
That's an awesome question, I love it, because one of the most difficult things to do is to match one central tooth to the rest of the teeth. And sometimes you just can't do it if there's too many things going on in the teeth. But many cases are really possible, and it's going to save the patient from having to have multiple teeth done, both in the cost and having to drill down extra tooth structure. But one thing that we have with the lab on site is we're able to do that. I'm going to show you another case real quick. This is a patient, again, you're going to meet her tonight. Her name is Kyle. She's actually a local DJ for one of the radio stations. You can see how this first picture before, again, another dentist when she was 14, I think 13 or 14, had done some bonding on her tooth. She had chipped the tooth and needed some. Well, as you get older, your gums recede back, and you can see how beautiful she is. And afterwards, you can see the difference with just one single veneer, just redoing that one tooth. Yeah, and we don't have to drill down extra teeth. It's almost undetectable which tooth we worked on, and you can even see again how big she smiles, and you know, she smiles with confidence no matter what. But another case of where it's really important to have the lab on site.